Hi, my name is Kelly Etchison. I'm 61 years old and I've been asked to do this video for you um, for whatever purposes you might see any value of it. In August of 2012, I went into a diabetic coma. My kidney shut down, my liver was shutting down, my respiratory system had shut down, all due to a small cut that I had on the bottom of my right foot. I did not know anything that was taking place the day before, and I ended up in the hospital. 2 days later, after still being in a coma, I had a surgical procedure where they did a partial amputation of my right foot. While I was in the hospital for about 3.5 or 4 weeks of that particular situation, I came out of the coma. I started my kidney dialysis and all the rest to try and get me back to the level of where I had been before, or wherever I could get, whatever improvement could be made. I had a cardiac stress test. A chemical stress test was being done, and while being put over onto the nuclear medicine table, my back was injured. The folks that were pulling me across didn't lift me, they kind of drugged me. MRIs later had documented that there were 7 herniated discs that we have from the cervical column down into my lower lumbar and in the thoracics. That has created numbness, which I have dealt with now for the past year in one fashion or another, from my fingertips to my shoulders, from my belly to my neck, and from my waist down to my toes. A friend of mine from high school, when I was trying to tell him, they've told me I will never walk again. The doctor had told me once I went over to the Nursing Rehabilitation Center, the doctor told me I would never walk again. And I said, well, what about the numbness? He said, well, that's due to your diabetic neuropathy. He said, once it dies, it will never come back. Well, a friend of mine from high school had referred me to a friend that he had, a business associate that he had, and he referred me to Dr. John K. Stull, who's a chiropractor over at Miami Valley Chiropractic over on 3205 Wilmington Pike. I was referred there. He was willing to take me as a patient, and for a number of months I came in as a gurney patient. Since then we have talked about that, and I'm not sure that he really wanted to take somebody who was in as bad off a shape as what they were telling me at that time. But an interesting thing took place. As we were getting adjusted, as John continued to adjust me, he found on 3 different occasions that I went totally numb-free in all of my body. I had no numbness anywhere, from my toes to the top of my head. Now it came back because they would get me up, and when they would get me up for physical therapy over at the Nursing Rehabilitation Center, they would have me up a little too long and the numbness would come back. This gave me encouragement. It doesn't sound like it, but it gave me encouragement because diabetic neuropathy kills the nerve endings. You cannot get your feeling back once diabetic neuropathy has killed the nerve endings. But mine came totally back, so it wasn't due to diabetic neuropathy. They also told me that I would be on kidney dialysis the rest of my life because I now had chronic kidney disease. I would be on insulin the rest of my life because of my pancreas being shut down. They said I wouldn't be able to run just because of my lungs, because my lungs and the collapsed lung would be a problem. The interesting thing is that Dr. Stull listened to me where other people were not. It took 5 weeks for me to convince an AMA certified medical physician to do something he had never done before. And I give him credit for that. He was willing to take a look at something that I suggested, which was let me go to a chiropractor. I didn't know that I was going to go to the #1 rated chiropractor in Dayton, Ohio. I didn't know the effectiveness that it was going to have on my condition. But I can tell you as a personal testimonial, which I'm not getting paid for at all. I don't want to get paid for this. I just want somebody else to understand that chiropractic is not just a theory of how you can do things. Chiropractic is a non-invasive therapeutic maneuvering and manipulation of the spinal cord, of the vertebrae that house the spinal cord, that can fix problems. And if you don't understand that, get any medical textbook and take a look at the picture of the spine they have and the little bullets that come out from the side that say that if you have problems with bronchitis, it was probably because of this vertebrae or this disc being compressed. Well, Dr. Stull, knowing that, I call him John, Dr. Stull, knowing that, he, being trained in that and believing that, adjusted those areas that were misaligned. Subluxated is what the term is. And he did that and left space for those discs to retract instead of being herniated all the time. One of the things that I did is I've been taking MSM, which is methylsulfonylmethane. My wife and I both take that and have been for years because it goes and works at the cellular level to restore the elasticity of the cell walls. If it would restore the elasticity of the cell walls, which allows the water and nutrients to get into a cell and the waste and toxins to get out, when that elasticity, which starts going about the age of 35 or 40, some people start losing that elasticity of the cell walls. But if we can restore it and keep that in there with MSM, that way those discs would also be willing to retract. So getting on MSM, convincing the medical doctor that I needed to get that while I was over at the rehab center, and then having the adjustments from Dr. Stull, we could make sure and keep those discs from being as pressured on. The decompression, which at first I couldn't do, we just had to do it with manipulation techniques. But after I got to the place where I had more core strength, that core strength that I did have was all but gone. I had lost 70 pounds in the first 2 months of being in the rehabilitation center and was on my way to dying. But after I got to Dr. Stull's office, which took 5 weeks for me to convince them, when I got there, that process was stopped. And while you go a little bit past in that rubber banding, I started getting better and better and better. I have continued to make improvement. They told me I would never walk again. I can now walk. It's not a normal gait, and I'm not going to win any races for the fastest walker. I'm not going to the Olympics, and I'm not going to be a high hurdler. But I can walk, and I can function in walking. The numbness, which used to be clear up to my shoulders, now, today, is only right at my wrists. Now it fluctuates a little bit back and forth, same as it does in my legs, but I was numb clear up to my waist. And I am now, as of this morning, it's down between my knees and between my feet on both legs. It is getting better. Those discs are still herniated, so when the vertebrae come down on them, it still does pinch the nerves. There is pinching, and I forget, there's other words that you can use for it, but basically the vertebrae come down and then the disc, which is sandwiched in between, gets pinched and pressure's on it, and then the nerve impulses don't go. Just like how when you have the water hose running at your house and you drive in the driveway and it runs over the hose, it's not going to let the water go through. It's the same thing with our bodies and those nerves. This is what has happened. I'm getting much better. They told me I'd never walk. I can walk. They told me I'd be on insulin the rest of my life. And with the adjustments that Dr. Stull has been doing with me, I'm no longer on insulin. I don't have diabetic neuropathy the way they have said. They called it that because they took a snapshot picture. Dr. Stull doesn't do that. He listened to what you've gone through, what you are right now, and says, okay, this is a snapshot here. Let's see what we can do to change it, because there's a movie that we go through. Our life is not just a series of frames. It's a movie, and we get to a place and we might be called stupid here, and this is the most brilliant idea we've got. And down the road, they may call us stupid again. The point is that we have these fluctuations of our intelligence level, of our experience level. Bottom line is, though, from my physical situation, I'm no longer taking insulin. I'm not on kidney dialysis. By the way, I do check my blood sugar regularly, and it stays in normal range. My lung capacity is increasing. I can sing again with quartets and the Dayton Area Men's Chorus, which I'm a member of. Those things are working. I am able to go without kidney dialysis. And that happened very shortly after I was coming to Dr. Stull's office. When you align the spine, things happen to you. When you misalign the spine, get it twisted, rotated, it goes anterior, posterior, which means front to back. or if you get it tilted to one side and it goes bilateral side to side. Any of those things can happen to us at any time. It could be something as simple as stepping off a curb. It could be something as being knocked down in a store like I was about a week or so ago. But I would have been debilitated if that happened to me a year ago. Today is the 24th of October 2013. Now, it's been a little over a year and 3 months or so since my original injury took place. But I can tell you that chiropractic works. Find yourself a good chiropractor. Make sure. It doesn't have to take something like what I went through to get you there. Some little something can start the process of diminishing the capabilities that you've got. Make sure that you get to a chiropractor. Find one that you like. Find one that listens to you. Find one that is knowledgeable. And if you don't already have one, I would highly recommend Dr. John Stull and Dr. Christine Dobrin at the Miami Valley Chiropractic Center. Thank you for listening. If you have any questions, you can be certain to call Dr. John Stull. I've given him permission to talk to anybody about what has gone on with me. This is a miraculous situation. I can walk again, and no insulin, and I'm not on dialysis, and my kidneys are functioning fine, my sodium levels stay fine. I am not completely back to where I was. We're not finished working on it, but we're going to get there. Someday we're going to get there. Thank you for listening. Have a blessed day.